something, and the doctor is supposed to listen to you, examine you, order the right investigations and make a diagnosis. That is what he gets paid for. To put it very crudely, my prosperity or my monthly salary or my monthly income depends on how ill you are. A doctor with a very good practice makes a lot of money. And what do you mean by very good practice? More and more sick people come to him. So it is you are being sick that makes a hospital thrive, that makes a doctor thrive. This concept is going to totally change in 5 to 10 years. Hospitals are going to make money by keeping you healthy. Promoting health is going to be the new mantra, and doctors will get paid for keeping you healthy. The more cardiac surgery I avoid doing, I will get an incentive from the insurance company. So the whole mantra is going to be stay healthy. 80% of all admissions to a hospital today could have been avoided if only it had been diagnosed well in time or preventive measures taken. And this is going to happen with information and communication technology. Now you can see an M prescription, remote monitoring, drug interaction, drug encyclopedia. Many doctors prescribe dozens and dozens of medicines. Even if I prescribe 4 medicines, if the human brain cannot remember that drug number 4 will interact with drug number 1 and actually neutralize the effect of drug number 1. Drug number 2 may potentiate drug number 3 and make it more toxic. I may forget that drug number 3 should not be given when your urea and creatinine are high. I may forget that by prescribing an antihypertensive drug, I cause a loss of sexual potency. So like this, there are hundreds and hundreds of data which some of us remember most of the time, but many of us forget some of the time. So today, when you prescribe a drug, immediately a red flag will come up, an alert will come up, and the computer will tell you, look, do not prescribe this drug and this drug, they are incompatible. Or an animation will come up and will say, did you confirm that your patient is not pregnant? Or does she have that? Does he have this, etc. Pharmacies, Apollo Hospital has just started this. Pharmacies are authorized not to dispense a drug prescribed by me if their computer shows an alert and it says that there is a possibility that this could happen. So this is enormous amount of information. There are probably at least 3 to 4 million data points here, which by touching a button we will be able to get it. So this is how modern medicine is going to be practiced in the future. Now I want you to remember this slide. Now this is a very detailed study which I'm just sending it for publication. It's not yet published. I did a very detailed analysis of all the members of the Neurological Society of India and the Indian Academy of Neurology, which are the 2 big, large professional societies. 90% of India's neurologists and neurosurgeons are members of this society. Now, when I analyzed this, I found 934 million people. It is not a mistake. I checked this 5 times before I made this slide. 934 million people in different parts of India. There is not a single, there is not even one neurologist or neurosurgeon who is catering to this. 30% of India's neurologists and neurosurgeons live in Madras, Delhi, Bombay, Calcutta. 30% live in state capitals, 30% live in Tier 2 cities, 7% in Tier 3 cities and 2.67% in rural India. The majority of rural India, covering a population of 934 million people, do not have a single neurologist or neurosurgeon. This is solid scientific data. I have no reason to believe that the data will be different in cardiologists, cardiac surgeons, oncologists, rheumatologists, dermatologists, whatever you call it. 90% of specialists, 80% of specialists cater to 20% of India's population. And this is not going to change, not for the next 100 years, purely because it is not that we are as human as any of you. Whatever the government says, I am not going to go and settle down in a village. Why? Because I don't have a CT scan, I don't have an ultrasound, I don't have an MRI. Where will my children go to school? Where will my children go to college? I want a car, I want an air conditioner, I want creature comforts. It's just not going to happen. But at the same time, using information and communication technology, we can be available virtually wherever we are. It was on March 24, 2000, exactly 15 years ago, that Bill Clinton, the then US President, formally commissioned the world's first VSAT-enabled village hospital, Aragonda, which happens to be the birthplace of Dr. Pratap Reddy, the founder of the Apollo Hospital Group. Since then, we have come slowly, we are progressing slowly, and if you come to my department, this is what you will find. You find 80 to 90 teleconsultations every day from 15 to 20 different parts of India. Today we have 135 telemedicine units in India, 15 outside India, but this is obviously just not enough. Now here you can see in remote parts of northeastern India, Agartala, Dibrugarh, Andaman and Nicobar Islands and so on. These are the places where we have. We also have centers in Afghanistan, Dhaka, Maldives and so on where you do teleconsultations. This is a typical example of what I do. Now here is a nurse from Tanzania, a Tanzanian nurse who came to our Muscat Telemedicine Center. This is an MRI of the brain. It shows that this lady has got at least 9 different tumors in different parts of the brain. She also has tumors in the spinal cord, etc. So I was able to do a detailed neurological examination sitting from my room in Greens Road, Apollo Main Hospital, with the patient in Muscat. I was able to talk to her, and then I told her that this should be treated with what we call stereotactic radiosurgery, which is what I have specialized in. And then she came from the airport, she came straight to the cyberknife room, was treated and then left. Here is a patient in Port Blair, Andaman and Nicobar Islands, which is a part of India, but is 1,800 miles away. It's an island which belongs to India. Obviously, there is no neurosurgeon, there are only 1 or 2 MBBS, not 1 or 2, about 10 or 15 MBBS doctors, but they have a CT scan. So here, this is from my house, I gave this consultation from my house. It is so ridiculously simple. This was about 10 years ago when technology was nowhere near what it is. Today, from the remotest part of India, all I want is connectivity. If there is connectivity, an ordinary phone, you don't require an iPhone 6, an ordinary entry-level phone, all I have to do is to take a photograph, put it on video mode, I can see whether the pupil is dilating, constricting or not, and I can direct the person at the other end what to do, as I did 10-12 years ago for this patient. He sent me the CT scan. Here you can see a small injury to the brain here. Patient is unconscious, but I told them what to do, and within a week the patient recovered completely and was discharged. It took just about 6 to 7 minutes of my time. So here another person, this was a patient actually from Delhi who wanted to see me, and I am able to do a detailed neurological examination of every single muscle in the palm, in the hand, of every single nerve, etc. The only thing that I cannot do at the moment is to physically touch the patient, but even that is going to change in the next few years. People like you, people who migrated to the US from India, an Indian team is working at MIT, Massachusetts Institute of Technology at Boston. I have visited the laboratory and I have personally seen this a couple of years ago. It's almost going to be ready very soon. What is called haptic sensor, where you wear a special glove with sensors, and with this glove, through your mouse, you can actually place the cursor on a big enlarged thyroid gland, and you will get a crude sensation. It's not the same as my physically putting a finger on the patient's thyroid gland. but I can still remotely find out whether that gland contains fluid, watery balloon, is it like a balloon filled with fluid, or is it solid calcification, is it bone? To that extent, I can do this 10,000 miles away. This is already available. This is an old slide, 2002. Now, of course, we have got plasma screen, high definition monitors, etc. But this was how we all started. You can see it's so simple. I can ask the patient to look to the left, to look to the right, look up, look down, etc. I can do a detailed neurological examination in just a few minutes from now. Today, everything is available on your tablet, on your iPad. The entire ophthalmic assessment, I can test color vision, I can do a visual acuity, near vision, etc. And here you can see this is a woman with a drooping of the eyelid because of a problem in the brain. I am able to do this completely. Now, I have given you a very rough idea of what is telemedicine. Now, I am going to talk to you about technology. The technology can be directed towards a patient, and as I mentioned earlier, post-symptomatic diagnosis will not really make tremendous changes in healthcare. What is required is pre-symptomatic screening, or the moment the first symptom develops, to try to find out what it is. Again, clinical convergence. We need all the various diagnostic tests, etc. must be linked to therapy. Again, productivity driven. At the end of the day, you will listen as you become older, as you get into the real world. Now you are all students, so luckily you are not involved in it. What is called ROI, return on investment. There is no such thing as a free lunch. Philanthropy at the best can start something, but it cannot maintain it. One of the reasons why I have not been able to succeed in telemedicine, why no one in the country has really been able to succeed with telemedicine, is because we still do not have a business model. For it to be self-sustaining, for anything to be self-sustaining, it has to be revenue generating. And the people who require telemedicine the most, that is those in the towns and villages of India, are people who can afford to pay the least. So unless there is insurance, unless insurance recognizes teleconsultation and doctors are paid for teleconsultations, teleconsultation will never really increase in this thing. Now, 3 days ago I was in Delhi and I was absolutely thrilled. There was a 2-day conference. I couldn't believe it. 2 years ago I would not have believed it. There was a 2-day conference, 8 hours every day on IoT. Anybody knows what is IoT? Heard of IoT? IoT is Internet of Things, or M to M, machine to machine. So what is going to happen is human intervention is going to progressively become less and less. A machine, if your blood sugar is raised, why should you contact a doctor? Why should you contact a nurse? Through Zigbee or Bluetooth or whatever it is, this information will be sent to a server, where the server program is so done that when the blood sugar is between 200 and 240, a message will go automatically, and let us say an insulin pump is already implanted into the patient. A severe diabetic, BP sugar goes up to 300. Through Bluetooth, the insulin pump is made to release through a semi-permeable membrane depot preparation, long-acting insulin. 5 units of insulin will be released into the bloodstream without your knowledge. You don't even know that your blood sugar went up to 400. You don't even know that a sensor picked up this. The sensor sent the information to a server. You don't even know that orders were given to the insulin pump to reduce insulin. All this you will know after the event happened. You will be able to see all this in the form of a graph, etc. So this is called M to M. As you can see here, it's relayed through a network. Instead of LAN and WAN, you are going to have BAN, body area network. So in the future, you will be having body area network. Various devices will be interconnected to each other. Unfortunately, in the real world, A diabetic is also a hypertensive. A hypertensive also has cardiac problems. Nothing prevents a person who's got diabetes, hypertension and cardiac problem from having osteoarthritis of the knee or a brain tumor or a combination of all this, etc. So multiple parameters have to be simultaneously monitored and action taken. All this is going to take place with very little human intervention. This is of course mainly meant for people like me with white hair, may not be for you, but this is what happens, what is called the hype cycle for emerging technologies. As researchers, as people working in a laboratory, you are full of energy, vitality, you want to change the whole world. I do as exactly like you, I want to change the whole world. I want to get 10 Nobel Prizes. So that is your period of innovation trigger, what we call peak of inflated expectations. You think that your discovery is going to change the world. Everybody wants the latest, the older, everybody, I don't know if you read it, but I understand that iPhone 6 has once again taken over the market, and the sales of iPhone 6 have exceeded everybody's expectation. Everybody wants an iPhone 6. It will take 1 year more